Disseminated candidiasis is a serious medical condition that often goes unnoticed until it has progressed significantly. This condition can be life-threatening if not diagnosed and treated promptly. It is a systemic infection, meaning it spreads throughout the body via the bloodstream, affecting various organs and systems. This means it affects multiple organs, including the kidneys, liver, spleen, and even the brain, leading to severe complications. The infection is caused by a type of fungus called Candida, specifically Candida albicans, which is normally harmless but can become pathogenic under certain conditions. Candida is commonly found in the human body, residing in places like the mouth, gut, and skin without causing any harm. However, in people with weakened immune systems, such as those undergoing chemotherapy or with chronic illnesses, it can overgrow and cause serious infection. Disseminated candidiasis is particularly dangerous for immunocompromised individuals who are less able to fight off infections. These individuals have weakened immune systems, making them more vulnerable to infections that a healthy immune system would typically control. This makes them more susceptible to infections, including disseminated candidiasis, which can quickly become severe. People undergoing chemotherapy, organ transplantation, or living with HIV/AIDS are at increased risk due to their compromised immune systems. Early diagnosis and treatment are crucial in managing disseminated candidiasis. Timely medical intervention can prevent the infection from spreading and causing further damage. Disseminated candidiasis can be fatal if left untreated, underscoring the importance of awareness and prompt medical care. It is important to understand the symptoms, risk factors, and treatment options for disseminated candidiasis. Symptoms can include fever, chills, and organ-specific issues depending on where the infection is spread. This knowledge empowers individuals to seek timely medical attention, potentially saving lives by catching the infection early and starting appropriate treatment. The symptoms of disseminated candidiasis can be varied. They often mimic other conditions. This makes diagnosis challenging. Recognizing the common symptoms is vital for early detection. One of the hallmark symptoms is persistent high fever. This fever often does not respond to conventional treatments. Chills may accompany the fever. Patients may also experience a drop in blood pressure, known as hypotension. Other symptoms include muscle aches or myalgias, and joint pain or arthralgias. Bone pain is another common complaint. These symptoms can be severe and debilitating. Disseminated candidiasis primarily affects individuals with weakened immune systems. This includes patients who are undergoing treatments that suppress their immune response, making them more vulnerable to infections. Understanding the risk factors is crucial for prevention and early intervention. By identifying those at higher risk, healthcare providers can take proactive measures to monitor and manage potential infections before they become severe. Prolonged use of antibiotics or steroids can increase the risk. These medications, while essential for treating various conditions, can disrupt the natural balance of microorganisms in the body. This disruption allows Candida to overgrow, leading to infections. It's important for patients and healthcare providers to be aware of this risk, especially during long-term treatments. Immunosuppressive medications, used to prevent organ rejection, also weaken the immune system. Patients who have undergone organ transplants are particularly susceptible to infections due to these necessary medications. Certain medical conditions such as cancer and HIV/AIDS compromise the immune system. These conditions not only weaken the body's defenses but also often require treatments that further reduce immune function. Medical procedures like chemotherapy and hemodialysis also increase susceptibility. These treatments, while life-saving, can leave patients more vulnerable to infections. Other risk factors include the presence of catheters, gastrointestinal surgery, and other invasive procedures. These can provide a pathway for Candida to enter the body and cause infections. Parenteral nutrition, which is receiving nutrients intravenously, and injection drug use are also significant risk factors. These practices can introduce Candida directly into the bloodstream, leading to serious infections. Diagnosing disseminated candidiasis requires a comprehensive approach. It involves a combination of clinical evaluation and laboratory tests. Blood cultures are essential for confirming the presence of Candida in the bloodstream. Cultures from other sterile sites, such as cerebrospinal fluid or joint fluid, may also be necessary. Imaging techniques, such as MRI and CT scans, can help visualize affected organs. These scans may reveal abscesses in organs like the liver, spleen, or kidneys. Section 5. Clinical manifestations, a closer look. The clinical manifestations of disseminated candidiasis can vary depending on the organs involved. Understanding these manifestations is crucial for accurate diagnosis and treatment. In patients with leukemia and neutropenic fever, which is a low white blood cell count, characteristic skin lesions may appear. These lesions are typically maculopapular, meaning they are raised and discolored. Fundoscopy, which is an examination of the back of the eye, may reveal fluffy infiltrates. Persistent positive blood cultures, despite appropriate antifungal therapy, may indicate renal involvement. Kidney involvement can lead to serious complications. Section 6. Treatment Guidelines 2024 Update. This section provides a comprehensive overview of the latest recommendations for the management of disseminated candidiasis, a serious fungal infection that requires prompt and effective treatment. The 2024 treatment guidelines for disseminated candidiasis emphasize early and aggressive antifungal therapy. This approach is crucial to improving patient outcomes and reducing the risk of complications associated with this severe infection. The choice of antifungal agent depends on several factors, including the severity of the infection, patient-specific factors such as underlying health conditions, and local resistance patterns. These considerations help ensure that the selected treatment is both effective and safe for the patient. Echinocandins are the first-line therapy for most patients with disseminated candidiasis. These medications are preferred due to their potent antifungal activity and relatively low risk of adverse effects. These potent antifungal agents have a favorable safety profile, making them suitable for a wide range of patients, including those with compromised immune systems. Specific echinocandins include caspofungin, micafungin, and anidulafungin. Each of these medications has unique properties that may make them more suitable for certain patients or specific clinical scenarios. Fluconazole, available in both intravenous and oral formulations, is an alternative for less severe cases of disseminated candidiasis. It is often used when echinocandins are not necessary, or when patients have a history of good response to this medication. Amphotericin B, particularly the lipid formulation, is an option for patients with neutropenia or those who cannot tolerate echinocandins. This medication is known for its broad-spectrum antifungal activity, although it may be associated with more side effects compared to other treatments. Section 7. Case Studies. Challenges in treatment. Case studies highlight the challenges in managing disseminated candidiasis, particularly in immunocompromised patients. These cases underscore the importance of vigilance, early diagnosis, and appropriate antifungal therapy. In one case, a 7-year-old girl with T-cell lymphoma developed disseminated candidiasis resistant to caspofungin. Despite aggressive antifungal therapy, the infection progressed, leading to her untimely demise. Another case involved an 18-year-old with B-cell acute lymphoblastic leukemia, or B-ALL, who developed chronic disseminated candidiasis during chemotherapy. This case emphasizes the need for high suspicion and prompt treatment in this high-risk population. Section 8. Prevention, a proactive approach. Preventing disseminated candidiasis involves minimizing risk factors, especially in healthcare settings and among immunocompromised individuals. Judicious use of broad-spectrum antibiotics and steroids is crucial. These medications can disrupt the natural balance of microorganisms, allowing candida to proliferate. Strict hygiene protocols in hospitals and other healthcare facilities are paramount. This includes hand washing, proper disinfection of medical equipment, and isolation of infected patients. Other preventive measures include regularly changing and properly managing catheters, using antifungal prophylaxis in high-risk patients, and educating patients about infection control measures. Section 9. Future Directions, Advancing Care. Ongoing research is crucial for improving the diagnosis, treatment, and prevention of disseminated candidiasis. Scientists are working to develop more sensitive and rapid diagnostic tests. Early and accurate diagnosis is essential for timely intervention. New antifungal agents with novel mechanisms of action are being investigated. These agents could overcome resistance and provide more effective treatment options. Researchers are also exploring the use of immunotherapies to boost the body's natural defenses against candida infections.